Ladies and gentlemen, please welcome Dr. Sammy Lamb.
Thanks, Will. Is the mic on?
Is this yours?
Yeah, it's mine. Thanks, Will. We're actually going to talk a little about skin, something you guys know very well, but I'm going to talk about it from a different vantage point, which is my own. And I'm really not going to discuss a lot about what you guys do because I don't know what you guys do well. And what I want to do is look at a good intersection. Next slide, please. So, do we live in different worlds? Are we far apart? Do you work in your own environment? Do I work in my own environment? How do the two intersect? Next slide. You can begin to see that there is a point of intersection. And what exactly is that intersection? Is it just peels and all that? I'm going to challenge your paradigm today. I want to teach you to think today. I'm really profoundly a thinker, and I really want to sort of revolutionize how you see skin, because my thoughts have constantly evolved. This is a brand new talk. I've never given it. I worked on it from scratch. Next slide. So what is that intersection? Next slide. Skin. How do I see skin? Next slide. Is it this? Well, of course, these are very, very important. But this is what you guys know well. So I'm not going to talk about that. Next slide. Sorry, my mouse doesn't work on my little microcomputer. We're going to talk about Botox. And so, well, wait a second. I thought this is a new talk. I thought there's something revolutionary you're going to provide for us. Isn't this old? Next slide. Next. Why Botox? First of all, I don't have any money with the company. I don't take any. In fact, last year when I was at the National Educational Faculty, all the money I received went to charity. I did not take the money, so I own no stock in the company. Next slide. We first have to understand why not Botox. There's a lot of apprehension. There's a lot of misunderstanding, and until we break through on an educational level, I think we fail. Next slide. First one. This is why we shouldn't do it, right? It's a poison. It's going to kill you. That's why you guys have been trained not to do this. I had an esthetician that was in my office a few months ago, and I realized I wasn't being educated in the world of for estheticians. So I said, you know what, at least I can do my job and provide that level of education today. So what am I talking about? Why is it a poison? Well, there's a study that came out of Italy that said it may go to the brain, right? So don't do it. That study was done in a mouse. It was not done with Botox brand. And it was done at very high doses. And I don't know if you know that a single 1-unit dose of Botox is a lethal weapon that can actually kill 50% of mice. That's exactly how it's defined. 1 unit won't even take care of half a wrinkle for you. So I want you to understand it's been around since 1979. And it's been around for cosmetic purposes since 1985. So the fundamental question I have for you is, how long do you want to wait until you believe it's safe? You can go ahead and wait until it's 2020 or 2030, but the wrinkles will continue to accumulate. So I want to challenge your thinking about Botox, and if it doesn't work for you, don't worry about it. But I want to break through some of the objections today first. Next slide. I'm going to look like Nicole Kidman. I'm going to look frozen. I guess it's going to work in Vegas if you're going to play poker, but that's about it, right? Well, understand that Botox is Botox. You need to work with a good injector and work toward objectives. So the first time, it can be a little... And I explained Botox like exercise. I think that paradigm is going to be much clearer for you. So I want to start with the idea that, well, maybe you will be frozen the first time, a little bit stiff. And eventually it's actually going to be much softer. We're going to talk toward, I like to say Botox is a relationship. And we're going to work toward an objective for you. So I want to sort of answer this halfway, but provide the answer in the coming slides coming up. Next slide. It's painful. I had it done. I was dying. I was crying. You know, I offer a different product. And it is very painless, okay? It is all technique. Technique is everything. And I always say that you can pay for good results, but a bad experience is something not great, because you need to have an ongoing therapy. And if at every time is you're wincing to come in to see me, I don't think that's always a very good option. And I don't use topical creams. I don't think they do anything. So I want to challenge what you think about that. Next slide, please. Waste of money. This is it. Let's focus on this. It's a waste of money. Don't do it because, heck, I got better things to spend my money on. It's a temporary fix. Look at it like a quick fix, like a drug, right? I want to take you away from that notion and pull you 180 degrees. I want to move you toward understanding long-term gains. That's right, exactly the opposite of why most people do Botox. They do it for the quick fix. I actually do it for the quite opposite reason. Next slide. What causes a wrinkle? If we understand skin, don't we have to understand what causes a wrinkle? We can talk about sun damage. Of course, sun is very, very important to destroying collagen, bad lifestyle, bad habits. You can get good skincare products. You can work with the skin. But what causes a wrinkle? Next slide. Movement. So how do you block the cause? If the cause is movement and we're treating the effect, are we failing to understand the cause? The cause is the movement. And if we continue on with just treating the effect and not the cause, we're still progressing. And I want to move you toward a different understanding of what Botox does. It heals the skin in a profound way. I'm going to show that through some photos. But first I want to introduce the paradigm. So we got to understand that movement is the issue. Movement is the issue. So let's take a look at this shirt here. I brought two shirts. Let's take a paradigm here. Let's say that we have the same shirt. This shirt I'm going to go ahead and wear for about a day, and I'm just going to hang it up. I'm going to hang it up right here. I'm not going to wear it again for 5 years. But you're going to wear this shirt, and you're going to wear it for 5 years. Let's say you iron it, let's say you press it, let's say you clean it. But you're going to wear it, and you're going to continue to wear it for 5 years. And we meet back together after 5 years. Which shirt is more wrinkled? What is the problem? It's the movement. Stop the movement. If you slow down the movement, you heal the skin. And the difference is, if I cut this shirt or if I cut this shirt, it won't heal. But if the movement slows down, the collagen heals profoundly. I'm going to prove that to you through some photographs. Next slide. So what are the options? The options are very easy. With Botox, you get better. Without, you get worse. If you don't start now, and I see you back in 5 years, the wrinkles will progress. If you start Botox, you'll heal to the point where I can pull you back 13 years in a span of probably 2 years with consistency. And then you can probably even slow down or stop. So we got to first understand, this is an original idea I came up with last year, which is the Botox scale. You're either going to continue to worsen or you're going to continue to improve. So people say, well, I have to keep doing this? This is crazy. I got better things to spend my money on. I say, give me that first 2 years. Give me that first year, depending on how severe it is. I had a 26-year-old girl come to me. It was a Dallas Cowboy cheerleader, had a lot of sun damage because she was out in the sun all the time. She gave me 1 year of Botox. She said she couldn't afford it anymore. I said, it's okay. I've healed your skin already. Move on. So now obviously she's going to still have movement, and we're going to have to maybe address that issue down the road. But I really want to fundamentally have you understand what I'm talking about when I talk about the Botox scale. There's only two directions: worse without, better with. Next slide, please. Crazy. What do you mean exercise? Think of it this way. If you work out once a year, do you get a little endorphin rush? Well, you get a little pain, you get a little endorphin rush. But what do you ultimately get over a period of 5 years? You get nothing. You don't get cumulative gains. I look at Botox as cumulative gains. Every time I treat you, you get better healing. And that's what's so profound, is that if we can continue with Botox on a regular regimen. How regular? Well, I'm going to help you work through that. Your first 1 to 2 years is your most critical time. I need to pull everything back. And once I've done that, we can start breaking that idea that maybe is consistent. How consistent? Well, we're going to talk about the idea of that relationship. So let's take an example. Let's say I'm going to train for the triathlon, and I'm going to work really, really hard to train for it. I'm going to spend 2 years training for it. And you're going to sit on a couch and eat potatoes. I always get the better end of the deal on the story, by the way. So let's say I'm going to train for 2 years, and then we stop at 2 years. We both stop. At the end of 2 years, and we both sit on a couch, 2 years later, I'm still healthier than you are. And the reason is I've gotten my body to a certain level. That's what Botox does. It heals the skin in a profound way. And once I've healed the skin, then it's not as critical to continue. I mean, it's great if you continue, just like exercise. If you stop exercising, it's not going to be as good. But we can start building that. And the other thing that you don't think about is, as much as the muscles tone up and strengthen while you work out, I soften them. So over time, they begin to heal. And the other thing you don't think about is bad habits. If you constantly lift your brows, I can see your wear patterns. And when your wear patterns give away wrinkles, I know what you're doing badly. And the thing we don't think about is, if I can get you through some consistency on the front end, on the first year, I'll break your habits. Because if you say, I can't remember not to lift my brows every 4 seconds or frown every 3 minutes, I will help you do that through the first years, break bad habits. Next slide. So I have a 16-year-old African-American girl that I mentor every Tuesday. Top of her class. She constantly writes notes when she comes in and follows me. And I said, just memorize 2 words: Botox heals. It heals profoundly. And I'm going to show you some photos to have you understand that. Next slide. So what are we talking about? Just like exercise, the first time you work out may be a little stiff, may not feel good. It may look good, but and then think of this. With Botox, the first time you go, wow, I look really good. And then when it's gone, you get this craving. You need it again. Oh, let's get it again. Let's get it again. I want you to look better. That's the endorphin rush analogy to exercise. But the thing that I want you to understand is that over time, if Botox is done consistently by a qualified, experienced injector that can deliver a better product, that fluctuation of variation gets smaller and smaller. And I can tell you, after 1 or 2 years of good Botox with me, even the person with the Botox completely gone looks almost as good as when it's there. The addiction is gone because I've healed the skin and relaxed the muscle. And that's really, really profound. I'm going to show you some slides to have you understand that. So you and I can partner, because part of the equation that's missing is Botox. Why? It's poison, it's dangerous. No, it's a fundamental rethinking of why it's so important. So we'll get to the point where the skin looks good. Next. I talk about this because it's true. As a lot of people say, come in and get Botox and call me when you want the next one. I'll set up the next appointment. The difference is that I want to train your muscles. What I'll do is I'll take metrics. At a year, I'm going to take your photo. I want to show you the improvement. When do I want to show you the improvement? When the Botox is gone. When you're coming back for the next round. I want to show you that fundamentally the skin is healed when the Botox is gone. Not there. Anyone can take a photograph 2 weeks later. I don't care about that. I want to get your mindset out of the quick fix. I'm talking about long-term healing. And that's what I want to show you is long-term gains with Botox. And that personal trainer will define metrics for you. And let's say your Botox is holding at 3 months. I'm going to push you to 4. What if it's not holding? We're going to stay at 3. What if I see one area that is not doing as well? Progress. I'll increase the dose. I'm going to work with you. Remember that phrase, Botox is a relationship. It's to let the skin heal. Next slide. This is a lady that hadn't done Botox before, started until about 60. And this is 4 years of Botox with me. The photo on the bottom is 6 months after her last Botox. There's an ounce of Botox in that photograph. She has complete mobility and freedom of that in that bottom photograph. But what you're seeing is complete, profound healing. You say, wait a second, that's trick photography here. I'm just seeing more than that. I'm seeing it's not only healing the big muscles, it's healing the skin. Are you insane, doctor? Are you introducing something crazy? No. No, I'm not at all. There's a concept out of the Philippines that I pulled in called micro-Botox, which is dropping little droplets of Botox into the dermal architecture. And think about it this way. We always are focused on big skeletal muscle. How about the smooth muscle? What controls your pores? What controls the textures? It's your smooth muscle. Where is Botox usually placed? With that big, heavy crunching noise and pain too deep? I'm not talking about that. Go superficial. Get it placed right between the smooth muscle and skeletal muscle. You're going to get profound healing if it's perfectly placed and distributed evenly over a wide arc. So you don't have this unusual crinkling. And so you get healing at the dermal level, even lesions, everything. And I don't do the rest of the face with this. I just do the movement area. So there's not really going to be a challenge for you in terms of, we can work as a relationship because the most movement's up here. And I always like the Vidal Sassoon thing, if you don't look good, I don't look good. And I'm going to help your clients look a hell of a lot better because we're going to work in a partnership to get that skin, because I can't do it without you either. Is it all about Botox? No. It's about understanding skin from a different level, a different paradigm. So if you look at this, everything is healed with no Botox on the bottom image. I want to repeat that to you. Next image. This is an esthetician who's 40-some years old, worked many, many years on her own skin, and this is 2 years after consistent Botox, 6 months after her last dose. The skin is healed. The skin is healed with no Botox on the image on the right. And the reason that's so profound is I want you to challenge you is what causes a wrinkle. Let's go back to fundamentals, is movement. If you understand wrinkles are a derivative product of movement, you understand that we must block the cause. Next slide. Next paradigm, light. Just want to make sure I'm staying on time. Next paradigm is light. Why does skin look bad or good? It's light. Light on the skin, right? Next slide. Do we look like this sometimes? Why do we look like this? Because, next slide, we always live in a world, next slide, always live in a world with overhead lights. Think about it for a brief moment. Unless you have a glorious diffuser, we always have overhead lights, wherever we are, outdoors, indoors, anywhere. It's always top down. So exemplify some problems. What are those? Next slide. Think about this. It's a new paradigm. You guys know I do fat grafting, so I'm going to talk a little about how that works on skin. Think about this very fundamental thing. If you, over time, become deflated in certain parts of the face, there are going to be exacerbations of wrinkles in transition zones. What I do is just reinflate it. So when we reinflate it, there's bounce. And think about one thing. When you see beautiful skin, can you not see it 30 feet away? The answer is yes. And it's partly due to what incredible work you guys do. And it's partly due to the fact that if I can give volume, I can create light reflex to show off your work a heck of a lot more. Next slide. What happens with aging? Is it just wrinkles? No, I just talked about wrinkles. Let's forget wrinkles. It's deflation. Even if we gain weight, it's deflation. It's parts of the body having deflation. What happens when the upper face becomes flat? Light coming from on top creates shadows, right? Next slide. What is the answer? This? Do we take that and move it further away? I'm sure you love this look, right? Next slide. No, because even if you stretch that skin over the bone, okay, using your foot maybe, you're going to have shadows. You can't stretch it over a skull. Doesn't work. We need to think about recontouring light reflex. So light on the skin is as important as the skin itself. Next. Fat transfer. What is this? Let's clear the objections. Next slide. Justine, next. Why not fat transfer? Next. I'm going to look fat. I've gained some weight. This woman looks thinner. Do you want to do a brow lift on her? Didn't. How about suck out the eye bag? Didn't do it. I added volume to her face. But I can slim a face with fat, and I also can widen a face that's too gaunt. That's what's artistry. That's called balance. I want to take the vocabulary of symmetry out. We're so focused on symmetry. I want to say one thing. It's irrelevant. And I'm not going to go through the whole explanation. Micro evaluation of the face of symmetry will not help you. It's about understanding the beauty of balance, how one part of the face harmonizes with another. And when there's light, you say, well, you trick photography, you must put a flash on her face. No. It's the same lighting in the same no ambient light controlled room. So you're not going to look fat. I can take someone heavy and slim them with fat. Crazy? No. I can take someone too gaunt and widen them so they look balanced. And not when we're at 25. Most women like it around maybe 30, 32 if they pass 35 years of age. There's a little bit of narrowing that occurs. But we have this linear approach from baby fat to senescence or aging that we need to look at where that transection point is, or that transition point. How do we know that? Old photos. That's where we start, so you don't look like an unusual individual. Next slide. What's the next problem? It's not going to last. My doctor told me it's going to go away in 3 months. I've had it done. It's a joke. Is a Ferrari and a Hyundai the same car? No, they're different cars. So don't condemn the car. Don't condemn a car. Condemn the brand of the car. My mom over here, where is she? Over here is almost 2 years out. One session, including her hands. Almost 70. So the idea is to have you understand is, go look at her. Has it lasted? Yeah. It lasts in 95% of my cases, and 5% I touch it up at a year for free. So I want you to rethink that whole notion. Next slide. It's dangerous. I'm going to get lumps around my eyes. My doctor told me it's scary. Don't do it. He tried it. He couldn't do it. Don't let him do it. This is what's dangerous is conventional eyelid surgery. What's dangerous is the evacuation of the eye frame. Let's put it back in. But it looks heavy, Doc. Doesn't that still look heavy when it's too high? Yeah.
No makeup comparison. Same lighting. But there's not the same lighting because there's more light on the face. So rethink what you see. Next slide. I've never had a lump around the eyes, okay, just to make that really clear. I just want a mini something. Let's just throw that word because it's a beautiful marketing term. I just want a little this. I call it the two-finger rule. Just walk in my office. I don't want that. I want this. No, this lady on the left is post-facelift. This is the after on the left. Do you like that? All right, so I have an aesthetic vision of what you want, what I can help you with. My goal is to guide you with that education toward a result, not waste your money. Otherwise, you can just burn it in the corner if you want. Next slide. Rethinking gravity. There's a doctor in California that actually took women at 60 and measured them over their photo at 20. What he found was that there was no evidence of gravity of the face. But doc, I look better when I do this. No, you don't. The brows could fall a millimeter. I want you to look at this distance from the brow to the eyelid. It's the same on both sides. Look at the eyelid. You say, well, the eyelid's dropped about a millimeter on the right side, or yeah, on her right side. It has, but it's gone up a millimeter on the left. There's no change. There's volumetric collapse of the brow. It is not a gravitational issue. And this is what's going to blow your mind. Factoring in weight, the jawline actually goes up with aging. What? Yeah, it gets bonier in the central chin. That's what I rebuild. Next slide. This is 1 year after fat grafting. You say, well, look at that lighting. Oh, my God, you must be a cheater. No, I hate cheating lighting. This is the same room, same distance. In fact, I had to turn up the lighting on the left to try to match it. This is 2 years of Botox with the photo on the right, 4 months out of Botox. She's about 85% faded on her Botox, but the skin is healed. So rethink what you think you need. But look at the light that bounces off. I can see when a woman walks through my door, a gentleman, 30 feet away their skin looks better. And that's what's great. Next slide. This is 1 year out, and you can see that she actually has a very top-heavy face. I created balance by giving her a nicer oval by designing that face and shaping it. These are all 1 session of fat grafting, not 20 like you've been told. I want to break all those misconceptions away. Next. 1 session. Uno. This is 2 years out, 1 session, same lighting. And she actually reveals she has no makeup on the right and no sleep. She still looks good. I can make you look good no matter if you have any sleep or not. But look at the light that just streams all over her face without makeup in the same lighting. It changes your mind about what's important.
Stem cells. I don't know if this is going to work. I've seen some changes. These are sort of really interesting slides, and I'd present them as more theory than practice, because if you believe that all your skin's going to look great just from fat, I don't know. There's some thoughts that over time, a year or two, this skin can look softer. I've seen it. It's not perfect, but it works. Not necessarily consistently. Next slide. This is a lady that wanted acne scars taken care of, and this is about 9 months out, and I just did fat grafting, and the skin looks a little bit better. Is it perfect? No. Next slide. This is a charity case I did for a lady in a car accident and tried multiple scar revisions for that right nasolabial groove and didn't work. And this is about 1 year out from a single session of fat grafting. The skin looks a little bit better. So I think this is really cool. Next slide. This is a book I wrote on fat grafting. I have another one coming out in about a year. I've already finished writing it, so just different thoughts I have. I'm constantly rethinking this. What's so important with this procedure is not just artistry and technique, it's safety. Understanding the evolution of fat over time. We don't have time to talk about it now, but I just want you to understand safety first, quality second. Very important. Next. Just rethink the skin again. Stop the cause. And think about how light interacts with your work. Those are the 2 things that take-home lessons today. Next slide. So this is the idea. Next slide. Where do we intersect? We can work together in a great partnership. My goal is to have you understand where that partnership works. Next slide. I'm going to finish this morning. This morning I was on my exercise bike, and I was really trying to evoke, for me, a role model in terms of public speaking is Steve Jobs, and I was listening to his Stanford address. It's brilliant if you haven't heard it. And one of the points that I want to take home that I thought was great was his idea that we don't know where our trajectory in life is going to be. Sometimes we're too adamant about pushing certain things that we need to move forward. But until those things happen, we realize looking back, oh my goodness, it's so amazing that that happened. For me, I was a history major in college. I never thought I was going to ever use history. It wasn't a pragmatic choice, but it really worked. Having written all the books and lecturing, I love this. It's given me the tools to get to where I am, connecting the dot backwards. But it all starts with one simple word, passion. Don't settle. If you love what you do, continue. Follow that. Never settle. Never settle. And what he said I thought was great. I'll leave you with the words that he left, which were, be hungry and be foolish. Love life and love everything you do. And that's the difference. Is if people ask me what my work and what's different, I boil it down to one word: it's passion. I love this. You can see I bleed for my patients and I bleed for my work, because this is everything to me. So I thank you. Next slide.
Thank you very much. One moment before you go, I just wanted to, first of all, is there, I know we talk often about the collaboration and networking, and is there a place where people can contact or communicate with you about referrals or creating relationships?
Justine, that last slide, could you pull it for me? Did it go up on the screen, just that very last slide, if you don't mind? Thank you. That's my email address. You're welcome to contact me. I answer emails every day. I answer patient questions every day, 7 days a week.
I wanted to say to you that I invited Sam here today not only to share with you the practices that he engaged in so that you have a better understanding of the technology and the advancements in his field, so that you can communicate those to your clients and also have a personal understanding of the evolution of what the doctors are doing and what they're going through and what they're bringing to the industry. Secondly, I want to bring a person that's very approachable. Sam will be here throughout the day, and I urge you to come up and communicate with him. I wanted to bring somebody that can both encourage you to develop relationships. These professional relationships help you establish your business. They help you establish your longevity, and they help you bring something more to your client than what you can give them personally. And it's very important, I think, and Sam embodies certainly the personality and the kind of personal approach that we can feel comfortable with in approaching a doctor, a person with his education and background and skills. So I invited him here for that very reason today, because I knew many of you would be able to connect with him, to bond with him, and to break out of your shell in order to develop the kinds of relationships that you need to with medical professionals and other professionals in our field in order to expand, not what we can perform, but what our overall understanding, knowledge, and sharing with our client base is. And so once again, I thank you for being here today. It's a beautiful
Thanks,
lecture.
Will. Appreciate it.
Thank you, Sam.